Good morning, and welcome to this session on the Jengu handwashing unit. So it's a handwashing unit developed for humanitarian settings. So obviously settings where public health risks are really, really high, and where handwashing with soap is really, really important. And the development of this Jengu handwashing unit is quite an amazing story. So it spans 9 years, and it brings together a partnership between the private sector, academia, and the third sector. And we have representatives of all of the organisations involved in this process here today. And so over the next hour and a half, we're going to go. They're going to take us on that journey of the development of the unit and how it's been tested and trialled in humanitarian settings. And then we're going to brainstorm together on potential next steps for this unit. So we have quite a huge panel, both online and in the room. So we've got first of all Vi Nguyen from ELRHA. She's the Innovation Manager with ELRHA, who are the funder. And then we have from Arup, we have Stephen Phillips, who's an industrial designer. So Arup are a really renowned engineering consultancy company in the UK. So they have looked at the design. We also have the London School of Hygiene and Tropical Medicine, Ian Ross, who's an associate professor, and they also input that kind of partnership and iterative development, also together with academia. And then from the Red Cross, who were both part of the user input to the design and also the implementers. From the British Red Cross, we've got Viviana Elevetto, who's the health advisor. And from the Kenya Red Cross, we've got Naomi Nganga, who's the data manager. So implementers, designers, academics, public and private sector. And then finally, we have Innocent Mbweze. I'm so sorry, Innocent.
That's fine.
Who's the associate of the African Population Health Research Centre, who I'm sure many of you know. And he's here together with his team, Sheila Simuyu and Dennis Ikeo, who are both online. So, welcome to the session. I'm going to hand over now to Vi Nguyen to talk about ELRHA and their perspective on working as a donor in humanitarian settings.
Thank you, Claire. Okay. Good morning, everyone. It's lovely to see you all, both in person and online. So my name's Vi Nguyen, and I'm the WASH Innovation Manager at ELRHA. So ELRHA supports research and innovation that addresses emerging and complex humanitarian problems. And we do this by partnering with a range of actors involved in humanitarian response. So from humanitarian practitioners to researchers to policymakers to equip humanitarian responders with knowledge of what works and what doesn't work in different settings. Now, the challenge that we face with WASH is that whilst WASH interventions and programs are commonly implemented as part of humanitarian response activities, there's limited evidence and limited good quality evidence on the effectiveness of those interventions in different humanitarian crises and settings. So this can make it challenging to understand what works and how to scale those solutions, but also how to improve and adapt emergency WASH response. So, there we go. In response to this, we have 2 research and innovation programs which are integral to our work. So from the innovation side, we have the Humanitarian Innovation Fund, which I work with mostly, otherwise known as the HIF, and that funds and supports the testing and development of promising, scalable solutions in humanitarian settings. And then from the research side, we have the Research for Health and Humanitarian Crises program, otherwise known as R2HC, which also funded this project that we'll be hearing more about on the Jengu handwashing units. And they fund and support high quality research to build the evidence base of public health outcomes in humanitarian settings. So it's through projects like these which are helping us really to better understand and to sort of strengthen the evidence base of what works and what doesn't work in different humanitarian contexts and in different types of crises. So since 2013, from both these programs, we've supported the development of more than 50 WASH research and innovation initiatives. These have been a broad range of innovations and types of research across the whole WASH spectrum. And we're continuing to build the evidence base of what works and what doesn't work, and we're still continuing to learn through these projects of what is possible and what is scalable. And so when it comes to hand washing, we know from the evidence that hand washing is a cost-effective public health intervention, but there is limited evidence on the sustainability of the hand washing infrastructure and behaviours in different types of contexts and humanitarian settings. And so this is where this project really fills that evidence gap and is allowing us to understand better what works and what doesn't work. And so with that, I'm going to hand over to the first presenter from the project team. So I'd like to invite Stephen Phillips, who is from Arup, who will be presenting. Just bear with me 1 second, Stephen. Yes, please. Sorry, I'm just trying to put you onto the large screen.
Hello, everyone, and please don't worry if it doesn't work. I'm quite happy to join just by voice if that helps.
Just 1 sec. Aha, you're up.
Ah,
Up. There.
Voila.
great. Thank you for that, Claire. Hello, everyone. Yeah, I'm Stephen Phillips, and I'm a product design and development specialist at the design and engineering firm Arup, and I'm just coming in from London. I'm going to tell you about the Jengu hand washing unit design and making process. So if you could roll on the slide, please, that would be great. Thank you. So why did we develop this unit, and why is hand washing in emergencies important? According to WHO figures from 2018, there are 21.3 million refugees and 40.8 million in internally displaced people worldwide. And as a result of humanitarian crisis, approximately 1/3 living in informal settlements. And during the acute stage of an emergency, diarrheal disease can cause 40% of mortality and up to 80% amongst children. With the rise in climate change, the conditions of climate change, we think this is going to be a problem that's certainly not going to disappear. The British Red Cross came to us with this problem that there was a lack of durable, quickly deployable and effective communal hand washing units. And they were looking for a solution to resolve this problem. So when this problem, when the Red Cross came to us with this problem, the London School of Hygiene and Tropical Medicine in London were brought in to help us to understand hand washing behaviours. But it was very much a collaboration between our three organisations, and it started back in 2018. Yeah, next slide, please. So before we developed anything, we really had to delve deeply to research and conduct in-depth research to understand the problem. So to help with that, we conducted a literature review to understand hand washing behaviour and what was known about hand washing infrastructure with the London School of Hygiene and Tropical Medicine and the Red Cross. There was a formative research stage where we visited Uganda and observed, conducted interviews, spoke to people within the refugee community about the issue and how they currently wash hands and what the barriers and opportunities were around that. But it also gave us a great opportunity to take a look at the local availability of materials and manufacturing capabilities. As part of the study, we also did a trawl of hand washing units that were already used in such contexts, but not only for humanitarian emergencies, but hand washing units that are related to this context. So units that were made for camping, for the outdoors, but also you know, the units that you'll see at the bottom here, like obviously the well-known tippy tap, and also these top tank units with a basin below. In Uganda, it gave us a chance to have a look around and about as to what hand washing units were available. And on the right hand side, you'll see a sink, a typical sink with a tap that we tend to associate with hand washing. But you'll see the drain is actually disconnected in this case, so it wasn't working. But it was very important to understand the context to this problem, and you know, what the barriers were. So we had a look at some hand washing units, and we all went through an exercise of identifying the strengths and weaknesses of each solution that was available. Next slide, please. Once we had completed that as a group, we all put our heads together and created a design brief. And the overview of the brief was to co-design and distribute a novel and effective hand washing product that allows equitable access to effective hand washing with soap and water in humanitarian crisis. And the here on the screen, we after creating the brief document, we went into a series of concept designs and prototypes. Top left, you'll see the local market that we saw in Uganda. This is kind of typical of the area to understand what was available. There was this kind of side aim to create a unit that could be made locally as well as centrally. So, i.e., by locally, it's relatively close to where the humanitarian crisis is happening. And you'll see just at the top there pictures of jerry cans. Jerry cans tend to be ubiquitous often in these locations, and they are globally available. Then we went into a process of developing some concept designs for the unit. Top right, you'll see testing of readily available rubber pumps. And these are pumps that can be used to draw water from a water container. You can use them with bare feet, and they actually pull, because they're a pump, they pull water from any location through to where they're going to be used. And top right, you'll see a test using a different kind of pump for people who have lost their legs. So we were thinking about developing the unit also for people of reduced mobility. So maybe drawing the water using this pump, using the flat of your arm. So it's a little more inclusive. The important thing was with why we were using pumps. It's because we wanted to draw water from the ground, from a water container placed on the ground, rather than a top tank, where the problem with a top tank is that you have to refill it and it's always above your head. And that means that the actual basin tends to be too low for a lot of people. On the bottom left, you'll see us, we had some workshops around, different solutions, thinking about the different concepts that were put forward. And in the end, we voted collaboratively in which concepts to take forward. Then the process was the center middle picture is just an example of one of the drawings that we would develop to communicate the design and the parts design with fabricators, with local manufacturers. One thing you tend to find around the world is that metal fabricators they tend to be around and about. And in Uganda and Kenya, but also other locations, steel fabricators who can weld and bend metal and cut metal are generally there because they repair things and they make things locally. So we use steel. And then on the bottom right, you'll see the fabrication of the first initial prototypes that we put together. Next slide, please. Then we went to a testing phase, testing the prototypes. Top left, you'll see a picture of basically the UK military testing the units on manoeuvres in a remote location in the UK here. So we could see how they performed for people who had never used them before. And in a really difficult remote location. It's very wet and windy weekend that they use them. In the middle picture, you'll see children using them here in London, testing out a child's prototype. And you can see the unit is drawing water from a jerry can through the spout, and then the water is drained just to the left into the gutter. So we wanted this idea that you could drain water from the unit to a drain or potentially into a soakaway as well into the ground. Top right is a picture of the unit being tested in Uganda, and some prototypes units were sent out by the Red Cross and assembled locally. They were early prototypes to see what challenges they had and whether there were any initial major problems with the unit. And in the middle picture there, bottom middle, once the pandemic happened in more or less in 2020, here in the UK, the units were deployed to a number of schools, homeless organisations, and those kind of locations. Once the pandemic was starting to ease a little bit, and schools were just starting to open up, so it's a great opportunity for children to test out the unit of a particular age. And then on the bottom right is just a picture of the unit. Actually, it was an opportunity that came up in 2020 with Save the Children. They received funding to trial the unit in Nairobi in a couple of locations in two informal settlements of Mathare and Kibera in central Nairobi. So 250 units were made quite locally and then deployed there. The feedback was gathered. Next slide, please. So as things stand, this is the unit on the right-hand side, just a schematic view of it. It's an open source design, so the design has been published online. There are drawings that can be downloaded by anybody who'd like to make the unit. It tends to be made not by anyone, but by experienced steel fabricators who have the knowledge and equipment to make such a unit. And the components are a mixture of components that you can actually purchase, but also components that can be fabricated. On the back there, you see this large rectangular piece, which is a mirror. And one of the things that came out of the research was that, a mirror is a really good prompt for encouraging people to wash their hands, but also to look at themselves as well. And it also supports, washing of the face potentially due to trachoma. You can see that water is drawn through the dark blue tube to the pump, which is a small soft rubber foot pump. and then it's pushed to the water spout, and then into the basin, the sink. One thing that came up from the research we conducted was that a lot of hand washing units don't actually look at all like a globally accepted, people wouldn't necessarily associate hand washing with a lot of the units that are out there in use, because the shape and the arrangement of the unit was very alien. So we wanted the arrangement of this unit to be slightly familiar, with a basin and a spout and a mirror at the back, and then an area where you could add bar soap or liquid soap. Soap is vital for effective hand washing. And the importance of soap is that it should smell nice, and it should be like a really nice experience for people washing their hands. So it engenders repetition and a nice experience. You'll see here the Jengu units available in a range of sizes. Before this ELRHA funded project, we had a young child size unit for toddlers, through to an adult size units, which are also suitable for teenagers over 14 or so, and a unit for reduced mobility. The mid-child size unit was specifically developed for this project, and it's a kind of stepping stone in between the young child size and the adult size unit. So yeah, next slide, please. So one of the side aims of the project was to have potentially a unit that could be made locally, but also it could be made centrally and then delivered, like most products. And in this case, we have actually collaborated with several manufacturers of products that specialize in steel fabrication and product assembly. And on the map here, you'll see some locations where the unit has actually been made. So we initially started out in the UK because that's where the project kind of started. And we have worked with fabricators in these other locations. And the one for this project is actually Nairobi in Kenya. So that's where the units for this product are made. Getting things made locally is interesting. It obviously has benefits because it supports the local community, and helps them to develop things like fabrication skills and also local sourcing. So those are definitely the benefits. So yeah, next slide, please. Just to talk quickly about the local manufacturing process. It has been an unusual aspect of this project. So the process we went through to find local manufacturers was to, first of all, identify a manufacturer. And if you're doing that from London, as we were, you have to do a remote search online to find companies that are able to do it. It is kind of nice to be able to do it locally as well. So people on the ground could do a local search of steel fabricators who also assemble products to find people who can do it. The second step is to exchange the design and the bill of materials with the manufacturer. Then from there, we will ask for a quotation. And that means that whoever is ordering the units can place an order with the manufacturer directly. And then the manufacturer will will need to source the materials, basin, hose, and fittings locally. In this case, the pump is not sourced locally, but it's a very small pump. It is quite readily available in many locations. And in this case, we sent the pumps out to the manufacturer, and they could be shipped or shipped over, so they could fit them. And you see number 6 here. It says pump sourced by a local sales agent or from the UK. And then the pre-production samples are made by the local fabricator for sign-off. And this means whoever is going to use or has ordered the units can check them and check they're working well. And basically the manufacturer can then continue with the production of the units. On the right-hand side here, just some snapshots of the local manufacturing process in Kenya, in Nairobi. And on the back of the truck there are a batch of Jengu units just leaving for, in this case, a local project in Nairobi. Yeah, next slide, please. So this process has been a reflection. It's great because it's a really slightly different approach to making things, and some reflections on the local manufacturing process has been really good for a good outcome for the project. Lots of learnings here. So the good things about local manufacturing is that you know you're seeking a manufacturer who invests in local fabrication skills and equipment, so it supports local enterprise. It nurtures relationships with reliable manufacturers, and it does rely on locally available parts and materials. So we design the unit so that the components are things that are relatively readily available, and anything that isn't readily available can be sent from elsewhere. So that was a reflection. The quality of parts, and we'll learn about this a bit later on, such as the base and the can vary. The National Society with high demand and lengthy expensive import protocols could stop critical components. So this was a learning that we found. So if there are components that are critical for the unit, and they're in relatively high demand, then they could be stopped by somebody. Could be the National Society or it could be the manufacturer. Next slide, please. So does local manufacturing work? Of course it does. We know that from visiting various locations around the world, particularly in developing contexts, people there are very used to maintaining, repairing, and reusing products in the local country. It does need an effective design with well-specified drawings, clear drawing information, bills of materials, and fabrication and assembly guidance. So we developed an assembly guide and also a video on how to assemble the unit, which is available online. It takes time to find and work with local manufacturers because it's not a quick process. It does take a little bit of time to set this up. It does require demand. So if in order to sustain the local manufacture of these products, it's useful if there is a demand, because then the local producer is more likely to invest their time in it. And it does need the Jengu unit and this sort of unit generally needs water, soap, and funding. Is always really important. This project was obviously funded by ELRHA, as we heard earlier. So these projects do need initially some funding. Next slide, please. So that's it from me, and I'll hand over to Claire. Thank you.
Thank you so much, Stephen. Great to have that background about the history and the process. I'm just going to get this back off and just check that Viviana's actually been able to
Hello,
Did you
everyone.
Aha, Viviana, brilliant.
I'm here.
That's excellent.
Can you hear me okay?
Yeah, we can hear you great, and I can see you. I'm just going to mute you. I'm sorry, I'm just going to put you onto the main screen so everyone can see you. One second. I'm being a bit of a klutz this morning. Voila. Okay, Viv, you're up. Over to you.
That's great. Thanks very much. Hello, everyone. My name is Viviana Oliveto. I'm a senior health advisor with British Red Cross. It's nice to be with you today. What I wanted to do was to give just a short overview of the study, and some of the elements have been covered by Stephen already, but let me situate you before we pass over to colleagues who could bring us through the actual implementation. Next slide, please. Yes, I just wanted to reiterate the partnership nature of this project and this piece of research, because obviously as much as having objectives in terms of improved hand washing outcomes, the research also focuses on the strength of partnership, and in our case, multi-country partnership, and relying on what we think it's really the strength of the Red Cross movement and Red Crescent movement, which is having a network of national societies and volunteers, and being a grassroots organization which can facilitate this type of studies, particularly when we're looking at behavioral change and community perceptions. And also a partnership between researchers here in London and the African Population and Health Research Center in Nairobi. So really enabling these networks of cross-geographical contacts between researchers and improving and strengthening local capacity for this piece of research. Next slide, please. Next slide, please. Sorry, there's a few repetition. Yes, in terms of, I think Stephen already introduced that, but in terms of the overall aim of this study, we want to assess whether providing crisis-affected population in increased access to hand washing facilities would have led to an increase in hand washing behavior. And for the hand wash facilities, we really looked at the fact that they are durable. So some of few points coming regarding to this from the study were already mentioned so far, but also desirable. And using the compendium of research around behavior change and sort of incorporating into the unit mirrors and things that would make the whole experience nice and desirable. In terms of specific objectives, we really looked at community perceptions compared towards the hand washing units and compared to what communities were used to or assumed would be a hand washing facility. Looking at as well actual increase in and sustainability of hand washing behavior with soap over time. And then a third point around that durability and maintenance functionality of the units, and having really a cost benefit indicator at the end of the study. And finally, an objective around producing the units at scale and how sustainable this would be locally, specifically locally. And so the different connection and work that Arup has been instrumental in spearheading, and that will also take place in the last few months of this project in terms of exploring local production and potential ways creating local demand. Next slide, please. Yes, this translated in our 4 key research questions, which you can read on the slide, and they are really related to acceptability, increased and so impact of improved hand washing outcomes, scalability and local production of the units, and durability of the units and requirements to maintain them over time. Next slide, please. There are most of methods used. Obviously, we focused on the 2 main objectives of the research. So to judge perceptions of the units, we had a piece of formative research composed of literature review and interviews with different members of the community, using both key informant interviews and focal group discussion at the beginning, so baseline and 6 months of the project, to really understand perceptions and expectation of the communities and experiences of using the units over time. To look at effectiveness, we relied on, again, on measurements at baseline and throughout the project through structured observation, assessing hand washing practices. We used a control group at the intervention sites. We selected key moments, obviously, of hand washing behavior before a critical point, so before cooking, before eating or feeding children, and after using sanitation facilities. And we had a survey conducted both at baseline and 2 months after distribution, and then 1 year after distribution, so the deadline. Timelines changed slightly because there were some changes to the lifespan of the project, but essentially the overall methodology and methods remain the same. Next slide, please. Yes, in terms of this, so we ended up choosing 2 sites for this study. In Uganda, we worked in Changwali refugee settlement, and in Kenya, we work in Dadaab informal settlement. These are some of the oldest refugee sites. You can see so when they were established on the slide, they have roughly similar levels of populations. And similar sort of setups in terms of shelter structures and living condition. Kenya, so Dadaab tends to be a little bit more dynamic in terms of arrivals. So there were more arrivals experienced throughout the project life so far. Whereas Changwali was fairly stable. So the only remarkable arrival was in 2018, and so before the project. And also in terms of wash situation, we had access to obviously water, to some level of water facilities, some level of sanitation with obvious gaps that you can see in the slide. And I think, sorry, next slide. Yes, this was my last slide because the most important part for you guys, now that you have an idea of how the units function and the rationale for selected elements, would be in the implementation, which is also where we were able to have some kind of dynamic findings that were already pointed out in the unit's design, and some indicators on the behavioral changes and what will be needed to sustain those over time. So I'll pass it back to Claire, who could manage the rest of the session. Thank you so much.
Brilliant, thank you so much, Viviana. I'm now gonna bring in, so we have a huge panel, so I'm now going to bring in Naomi, who's the data manager for the Kenya Red Cross, who's going to be talking then about implementation and how the Jengu handwashing unit really performed in practice. So Naomi, welcome. Over to you.
Thank you, Claire, and I hope that I'm audible enough. Yeah, so I will be giving like a deep dive into the distribution process of soap. As Viviana has explained, this was a case control study where we had 2 groups. So the control group was receiving soap only, and the intervention group was receiving both soap and the Jengu hand washing unit. Next slide, please. Yeah, so we had a total of 300 participants or participant households in Kenya, whereby 150 of them were the intervention and 150 were control. And so this means that all the 300 households were receiving soaps. So we managed to distribute soaps in 4 rounds, whereby each household was getting 8 bars of soap, and each soap was about 250 grams. So in total, each household was getting 1 kg of soap and the distribution was done after every 2 months. Apart from distributing the soap to the study participants, who were 300, we also supported the host community in Dadaab, specifically a village called Bulakair, whereby we supported 112 beneficiaries at the end of the study, where each household received 8 bars of soap just for 1 round. And apart from that, we also supported 112 patients within the E41 main hospital in Dadaab. Again, each patient getting 8 bars of soap. And the selection criteria for this was lactating mothers or household with lactating mothers, and also mother with children under 5 who had been suffering from diarrhea diseases. Next slide, please. So since we were working in an emergency setting, it meant that most of the people or most of the communities that were living there were vulnerable. So we had to be a bit innovative in the way that we were distributing soap to ensure that, one, to ensure effectiveness and efficiency when it comes to the distribution, but also to ensure that the intervention is delivered to the correct households or participants. Again, because we were collecting a lot of information during baseline to just, again, support in terms of monitoring the rounds of soap distributions processes and spot checks. We collected a lot of personal information, so including their identification, their names, a number of household size and such. And so we needed like a robust system that will help in terms of maintaining the records and also ensuring integrity of the randomized trial through accurate group allocation. So to do this, we leveraged on a digital solution that Kenya Red Cross mostly uses, which is the Red Rose platform, to support in terms of managing the in-kind distribution, in this case, the soap. Next slide, please. Yeah, so some of the key features for this platform is that it's an end-to-end platform that allows you to register participants through that platform. And then you're also able to track real-time records of the distribution, what is in stock, what has been distributed, and if there's anything that has been procured in the process. And then it can also support in terms of doing post-monitoring distribution surveys. And also it gives you like a dashboard whereby you're able to get real-time reports and also analytics to guide in terms of decision making. Next slide. But before we did the soap distribution, community engagement was really critical for us because we were dealing with a very small proportion of the entire population. Then we needed to really engage with our community leaders and also the community members themselves to understand why we are considering only 300 out of about 90,000 individuals who are living within the camp. So we had to really engage them in terms of explaining the purpose of the study, explaining why some people are getting soap and why some are getting soap and Jengu units, and also engaging these community leaders in terms of even selecting the households that were going to participate in the study, but also in terms of supporting the verification of those households to ensure that when we are doing, for example, like soap distribution, they support in mobilizing the households that were already enrolled in the study to ensure that only them will come for the soap when we're doing the distribution. And since we were not doing distribution at household level, we were doing it at a central place, then this engagement was also very critical to ensure that these community members were suggesting a central place that could serve the diverse communities within the camp. So before doing any kind of distribution, we had to conduct these community engagements to just, again, brief them on the kind of activities that we are going to conduct, but also working with our staffs and volunteers in the field to train them on the relief distribution SOPs, and also just doing like a refresher of the Red Cross, Red Crescent fundamental principles and division of roles, because again, that whole distribution process, we needed someone who could support in terms of verifying the IDs, scanning the vouchers, someone in charge of doing the distribution of soap, someone in charge of also the collecting community and feedback from the community with regards to the whole study. Next slide. So this is just a summary of how that platform works. So the registration was done through a Kobo platform. Kobo is a data collection platform that is directly linked with that, with the Red Cross. And then again, you collect all the demographic information that you need that can inform eligibility criteria. And then once that is done, we were doing a random assignment of control and treatment, whereby at baseline, when we were conducting the baseline study, the community members had to choose between A and B, but it was double blinded. So we also, at that point of baseline, we had not decided, we were not decided on what A will be or A will be or B will be. So after they selected that, then we randomly assigned. So those who were A were in control, and those who picked B were in treatment group. So again, this was fed into that platform. And then after that information is fed into the platform, the system now generates digital voucher for each eligible participant. And these vouchers, in this case, will only represent the soap, because that is what we were giving in different times. And the vouchers are linked to the profile of the person. So at the end of the day, we know that this participant will receive X amount of soap throughout the study period. So during the time of distribution, that study participant will come with their identification document that they had registered during the registration stage. And then we will scan to ensure that it matches what is in the system. Once it matches, then we go another step to scan the vouchers and marking them as redeemed from the system. So once they are marked as redeemed, then that means that we are able to track in real time to know that these are the number of participants or beneficiary, in quotes, who have received this number of soaps during this stage. And that means that we are able also to get a report of the participants who've not come for the soap during that distribution process. So from that, then we were able to just pull out their contact details and call them for just a follow-up to understand why they had not come to receive their soap, and if they were available to come to receive their soap within the next few days. So we gave a window of about 3 days, whereby if a person was not able to receive or to come for the soap during that day that we had marked for soap distribution at centralized place, then they could come for the soap from the main hospital where Kenya Red Cross usually operates from, and claim their soap. Next stage. Yeah, so some of the key benefits of this process was one, to just reduce the manual process, which usually is a bit lengthy and also error prone. So it ensured accuracy and just ensuring that only registered and verified beneficiaries received the items. And also with regards to transparency and accountability, we were able to see how many people had received or redeemed their soap at a certain stage and how many were pending. And so we were able to track that stock to know how many stock of soap do we have in our system vis-a-vis what we have in store, and do the balancing. And again, in terms of efficiency, as I talked about the manual process, which is usually a bit lengthy. The other thing that also was heavily considered was data protection issue of the beneficiaries, considering that we were working in a refugee setting. So it was very critical for us to ensure that the information that we collect from these participants will not be leaked. And the platform provides that aspect of data protection. If you can go to the next slide, please. Yeah, where it has multiple layers that have been put in place for data protection. Again, there are different levels of encryption, both when the data is at rest and when the data is being transmitted from mobile devices into the platform. It also provides an end-to-end encryption, and there are layers of different rights. So there's a person who can only upload the data. There's someone who can edit. There's someone who can only view and such. But the most important thing is that also the platform is GDPR compliant. And there are also some clauses that the International Federation of Red Cross and Red Crescent has drawn together with the Red Rose company to just ensure that data protection issues has been put in place well. Next slide. Yeah, I think that's it about that whole process of soap distribution. We had developed like a just 1 minute video to just summarize the whole process.
But I'm afraid we weren't able to integrate the video into the PowerPoint. I'm really sorry, Naomi.
It's okay. Thank you, Claire.
Share us at the end if that's okay. Thank you very much. So thank you so much, Naomi. Let me now welcome Innocent to the stage. She's going to be talking about the evaluation and the learnings from this process. Okay. Sorry, I'm getting this wrong. So we're just going to take a second, because obviously that's a huge amount of information in terms of both the development of the hand washing unit and also the implementation alongside this voucher system for soap. So are there any questions in terms of clarifications or additional information that people want now? Yeah, and any of the team? I'm having a look online. I can't see any questions or anything in the chat. If not, then we're going to have a bit of time at the end to have a bit of a brainstorm about next steps and kind of your feedback on this process. So let me hand over to Innocent. Thank you very much.
Yeah, good morning everyone, and thank you for finding time to be part of this session, both online and with you guys here present. So I'll basically take you through the preliminary kind of results. Like you have seen from the previous presenters, we collected a huge of data, and we just finished the fieldwork processes. So we are now trying to understand the findings we have. So what we shall be presenting is just a piece of some of the information we did collect. Okay, so we now have a brief about the study setting, and Viviana also gave us a brief about basically the areas we are doing this study. It was being done in Uganda and here and in Kenya, but then for this presentation we'll only be focusing on Kenya. And the study was conducted in Dadaab, like Viviana did already mention, and this is basically a semi-arid kind of environment with over 380,000 refugees living in a camp. And also, yeah, their temperatures are high, 36 to 56 in terms of humidity. And also it's largely a flat area with loose kind of soils. So when it's windy, you can also imagine what takes place. Yeah, so in terms of some demographics, and I know Vivian already hinted on some, so now these are just drawn from the population we did study. So majority of our respondents were female and within the age range of 30 to 49 years. The refugees mainly live on rations from the humanitarian agencies. So in terms of their livelihood, so much of this is really attached to what the humanitarian agencies can be able to provide. So when there are inconsistencies, so you can also think on what it means to our behavior kind of practices. Yeah, and of course the majority of these had stayed in that area for pretty long, and they're mainly Somalis kind of refugees from our neighborhood Somalia. So the process, I think, has already been talked about. It was such an interactive kind of process from the pre-study design to the end of the study itself. So we had different series of engagements with the communities, with the stakeholders there, and of course also going along with conducting baseline kind of information to then feed into the interventions, which was basically, we were studying the Jengu handwashing facility, but also this ethical goal. If you're promoting hygiene, then the soap comes in for all groups to benefit. So soap was a neutralizer, and itself can have an effect on the outcome, and we shall be seeing that. But which was novel because the whole study was around promoting the hand washing of soap behavior and seeing how much having a fixed facility contributes to that process. We didn't do any behavior change campaigns in this study, so the results will only be speaking to the Jengu facility and the presence of soap in these households. Yeah, so and one thing led to the other. So from the time we did roll out the study, after 2 months, we wanted to see the quick behavior kind of responses towards that. And then the process took its natural course through the study period till the end time we had to go and do the end line. Oops. Yeah, so we now go to our study question. So like Viviana did mention, so we're interested in seeing whether providing a population, the crisis-affected populations with a desirable, more durable hand-washing facility could actually improve their hand-washing with soap behavior. So that is the whole thing we wanted to find out in this context. And the image we show there is just one of, again, the facilities in action. That person do washing her hands with soap, and it can tell you that actually his hands were visibly dirty if the picture brings up that image. And again, Stephen spoke about the facility itself with all its features, and that is it now in this setting. So, what do we see? What do we make out of this when you look at these bars? So what we present here are basically hand-washing moments. And specifically here, we have only limited ourselves to the moments of hand-washing with soap. So meaning that those are missed opportunities that we haven't presented here. But here we're only focusing on the moments people in this homestead were washing their hands with soap. Now again, what we should bear in mind, these moments are not restricted to one person who was in this homestead. It's all members of this home, both the children and the adults. And some homes, of course, the population size varies. So we're observing all members in this home during the period we were there, which was always like 1 hour to 2 hours and and 30 minutes. And the way we framed this was our interest there was to understand the daily routine of what happens in this home. So not necessarily fixated hand washing behavior, then you make them change everything, and every time they'll be washing their hands and washing their hands with soap. So it was, our intention there was to observe the general routine, understanding the general routine of what these people go through. So these are the hand washing moments with soap. So when you look at our baseline, again structured into control and interventions, and like Naomi has mentioned, so this is like hybrid. So it's intervention, it's control, but there is a modifier, which is soap, that is happening across the groups. So at the start, we realized that they're almost at the same level of hand washing with soap, which was around 48. And then after 2 months of rolling out the interventions, then we see a spike in terms of the moments, in terms of the times people are washing their hands across the different age groups. And of course, what we see overall now, all groups are having a spike in terms of appreciating the importance of washing their hands with soap. So we have more moments of observations, which coincidentally these also relate to the self-reported hand washing behavior with soap. We are not showing this graph here, but they relate. And those of you around that will be attending the afternoon session, that will come out. So after the first 2 months, when the program has been rolled out and you see this spike, so in the long run, the natural course now begins to take control. And what you see in the end, you see that actually this suggests that now the soap itself becomes an important factor for people to wash their hands with soap. So irrespective of whether you have a stationed hand washing facility or not, that is what it is seeming to suggest. And again, as we go on, we shall get to look at these results critically, and then we get to know where this could be coming from. But then what we see, if you compare with the baseline, you see that really the presence of soap, or even the fixed hand washing facility, does play a role in stimulating increased hand washing behavior. Okay, so the fundamentals, well, soap is important when it comes to hand washing, as well as water. So ideally, during the initial stages, we also had to make sure that the community, for example, had access to water. So if there's no access to water as part of the section criteria, that would have been difficult. But overall, we see how soap plays out, and this also shows where soap was, because our study was limited to the compound spaces, so we could not enter the households. So we'd only sit somewhere strategically in the compound, and we had 2 enumerators going together. So in a way, the household survey always took short period of time. So then the presence of a partner then creates an engagement, so that you don't create some kind of uneasiness in this home. So the 2 would maintain their conversations as at the same time trying to observe what is taking place within the space. So in terms of soap, then we're interested in knowing whether there's soap available in this compound at the time these guys entered there. And if there's soap, then the other interest was to know where this soap was actually situated, whether it was closer, for example, to the hand washing station or not. So what we report here is the presence or absence of soap. And for those that had soap, then we're interested to know whether it was situated closer to the hand washing station or it was somewhere within the compound. So, and yeah, this is what our results bring out. So largely, overall, most of the soap was there, but it was not near the hand washing facility. But as you go on, if you look at the post-intervention, then you see, oh wow. So now most of the soap, they started appreciating that to perform the behavior, it makes a difference for the soap to be closer to the hand washing station. And though it declines overall, at the end, you also still see that for the intervention group, this is still key. So there is soap, and it's available closer to the hand washing stations. So this is what this one brings out. And the presence of water, like we said, it's key also to the performance of the behavior. And overall, the community had access to water. Of course, the time it took to get this water was different because most of them spent, like 73% of the population spent over 30 minutes to go to the water source and back. So, but overall, in terms of the water being present in the home, most of them did have water. Yeah, so for the hand washing moments, what this one brings out, I hope we cannot see those behind, it's pretty small, but what it brings out, of course sometimes we have hand washing behaviors, the way we perceive and critical hand washing moments, but also those hand washing moments that are critical to the community or what they perceive as important times for them to wash their hands. But what this now brings out is overall we're seeing critical hand washing moments where these people are using soap compared to the baseline. And this is only looking at now in the intervention group where we're seeing that there was an increase that people were washing their hands with soap compared to the baseline, looking at the very critical moments. But also, if we want to internalize these results further, we could also say to achieve effectiveness in disease prevention through hand washing with soap, then it's also good to trigger targeting of all moments. So but this comes out like so. From these kind of findings, then how do we use them to develop targeted messages? Yeah, so in a nutshell, we're seeing that where the intervention itself, there are changes in terms of appreciation of hand washing with soap based on the facilities. So the question is, what would happen? Like, which kind of results would we see if we actually had behavior change interventions going on alongside the hardware, which is our soap now, and the Jengu facility? Yeah, so that was about that regarding the findings, the short findings. These are short findings, like we say, initial findings. There's still a volume of data we still have to look at to supplement this. So we are now focusing our mind on the technology on our Jengu facility, because one of the other motives was also to see how it performs in these crisis-affected populations. It's a new adventure that we're there to learn on how actually the community interacts with it. Yeah, and overall, they do like the technology. It's really fun. It's really great, and especially the presence of a mirror, like also Stephen hinted on it. So you're washing your hands at the same time you're seeing yourself. So there's great appreciation in terms of the features of the technology. And here I just pull out again one general statement from one of the household heads in these settlements that says, "I feel happy. The hand washing facility is working and benefits me a lot. When children would come from Mombalasa," so that's a Somali word, meaning school, "and was away from home, they used to eat meals without washing hands. But it is now different, and I have personally gained a lot too." So they appreciate the technology, really. They appreciate the hand washing facility. But also, they also expressed their concerns, and this was mainly related to the issue of basins. So these basins were largely fragile in this context. And also, the other aspect that some of them reported about was about the pump. Like Stephen did mention, the facility is made for different kinds of groups. We have the children, we have the people with disabilities who can use and then we also have the middle-aged children. So for the light children, the pressing of the pump becomes difficult. So if you're really too light, because it needs some level of strength. And that was some of the experiences some did report about. Yeah, I bring out this again to look at the functionality, to bring about aspects about the durability and maintenance of the Jengu facility. So overall, the facility is great. So most of their concern that was reported was around the basins, because we did ask about whether the facility was still functioning, whether there are some parts that are dysfunctional, for example, and which kind of parts were dysfunctional on the facility. And most of them, like at the baseline, after 2 months, when we had rolled out the intervention, so 27% did report that their basins were cracked. And then, and again, these images keep on changing. So the first picture up there, it shows, yeah, the nicely still functioning facility. And then the lower one, it's when the basin totally like cracks, and then ideally the facilities, the whole other pieces are rendered, you know, like useless. Like they're abandoned, everything is abandoned. And again, these are things to reflect on in terms of working in this context, in terms of some of the facilities we provide from the humanitarian agencies, which are like a one-time, like you go, there's this need, you put this facility, and in your mind you're thinking it's going to still serve the purpose. So if you don't have these kind of processes to know actually to test and be sure that by the time some of our initiatives are rolled out in the communities, they are actually more resilient, yeah, then we may be missing out a lot. So this is really great learning. So at the end, after the whole cycle, we realized that over 0.5% of the population had the facilities, but the basins were no longer there, were no longer functional. They cracked and they were spoiled. And what this would mean that then they had to go back to using the mobile kind of facilities, and which could also now feed into, again, our results. You see that leveling of the results, because when you have the other facility, it has no basin, so you can't use it. You still use your mobile kind of facilities. So, so like this then informs the next kind of engagement. So what kind of basins do we need to reflect on? And this will always be part of the discussions. So like at the end, you see 96% of the facilities that had defects were related to basins. And then, of course, you had a percentage of jerry cans, then the pipes, and 4 pumps, and then the mirror issues. But overall, the facility is there, but it's thinking around the basins. Yeah, so coming to the end, so in terms of some of the contextual kind of challenges and some mitigations, of course, this project started slightly before COVID, but COVID had a toll on it in terms of starting the actual field kind of activities, because it engaged the communities. So there's that kind of time lag, and in the depth, there's also issues of security that we always have to be mindful about, the movements and everything. It's really super controlled. People work within different time zones, so like you're not supposed to be in the field after 3. So all work has to stop early. Then, of course, contextual issues related to understanding the context and environment is really important for you to begin the actual kind of processes, the language dynamics. Most of them are Somalis, and with also some different tribes. That means that in our study, we had to make sure that people were only going, or enumerators were going to places that they understand the language. And also taking time to make sure that the enumerators actually understand the content of the information we need to generate, so that it's truly representable. These areas, like we said, are flat, and with loose soils, so heavy rains, droughts, they are actually supposed to hit by this kind of weather extreme events. So then what does it mean also to all these kind of initiatives? Yeah. Okay, so we go to the lessons. So in terms of the lessons, we did package them differently. So one, we are saying the availability of soap, and also in terms of its sufficiency, becomes a key factor to sustainable hand washing with soap behavior. And again, it could be the aspects of mind kind of change and engagements with these people to appreciate its importance, so that it's not humanitarian dependent, but you can also invest in buying it. Okay, so the other aspect is, of course, different hand washing moments are performed in different kind of areas. So you may have a fixed hand washing facility, like the Jengu, placed at a certain place within the compound. But if your moments, for example, happening in the toilet, so where there's great use of mobile facilities, you'll perform your behavior there. Or if you're sweeping the compound and there's a mobile facility the other side, you might have to do it there. So there's also this flexibility, or how much the effect of the mobile facilities that are greatly used in these areas. And also part of our GMP, we don't also define actually which kind of hand washing facilities, it's just open, also affect the performance of these facilities. And this also relates to some other studies that have been conducted in other areas. Then also hand washing with soap could also be increased and sustained if complemented with targeted continuous messaging and sensitization initiatives. So this wasn't part of our study. So our interest was to understand how much a fixed facility contributes to increase in hand washing practices with soap. But if complemented, then it also becomes important. And then the issue of capacity building and involvement of key influencers is important in promoting hand washing. And here we bring it out. We had to do lots of engagements, like Naomi did mention, with the local leaders and the block leaders, so that in a way we are moving together and they appreciate the process. Of course, beyond that was also to give justifications on why we are selecting certain kinds of people and everything. But really, they play key roles because they know their people and they can easily bring out certain kind of aspects that we may not be mindful about. So equipping them with knowledge becomes crucial to play that role. Of course, one thing that can't be emphasized more is the issue of collaboration, integrated collaboration between stakeholders, which is also critical to learnings and improvements in our systems. So in terms of the technology, which is the Jengu facility, in terms of the lessons we also draw, so holistic effectiveness of the Jengu unit in this kind of instance was affected by the basins that we used, because most of them are fragile to this particular context. Because of the heat, they easily do what? They easily got cracked. So that was a learning. So that was also a reflection thing through going forward. And then also the issue of local artisans' involving local artisans to fix some of the fixable parts could also be important. Like, for example, if the basin is cracked and you know that there is an alternative basin, then this person can be able to fix it alongside the pipe so that the two are easily connected. So these are important, and we actually did use them when we initially transported the facilities there, because some were already cracked before we supplied them. Then the permanency of the parts on the Jengu we might also need to think about them, so that if you use screws, for example, as an option, so that they can easily be replaced in terms of breakages, but also if you need to move from one place to the other, in the current form is heavy, so to allow mobility, especially when we had floods, it could also be a good option. Then future alternatives could also be around the foot pumps, like Stephen did mention. Currently they are not available in the local markets. All the other parts are there, apart from the foot pumps, and getting maybe alternatives around that. Then having the basin ring tailored to the small or medium. So having the basin, so it has a basin ring. So then that basin ring, if it's flexible to the most of the medium basins in the market, then it allows easy replacement without going back to the manufacturer. Yeah, so overall that's the nice, beautiful team that was in the field, but of course beyond that we have this big team. So that's Naomi, that's Vishna, that's Innocent, that's Sheila, that's Dennis, and that's George, that were in the field. Yeah, thank you so much. Back to you.
Brilliant. Thank you very much. Thank you so much, Innocent. So, we did have a plan to do a big group exercise on pick your brains. However, unfortunately, we're almost out of time, and we still want to get some feedback from me and Ross in terms of like final thoughts on the behaviour change elements, particularly. So we're going to jump over this. However, Innocent is going to be in which room this afternoon?
Well, it's still going to be in this room.
Ah, okay. So Innocent will be back here this afternoon. So please, if you could take that question away with you, and come back with any thoughts. And please do share them with us, that would be appreciated.
You can skip me and just let, I mean, it's more important because then I get feedback, I think, isn't it?
Yeah?
Yes,
okay, if that's okay with you.
Yeah, because people have listened and they might have ideas and it seems a shame to use them.
Yes, okay, oh brilliant. Okay, thank you very much. That's really kind. So in which case then, well, one question is, do you have any questions for us? And if not, then we do have this question for you. I mean, particularly for me, oh, sorry, what's the answer? Yeah, and also obviously for the people online, this is also a question for you. I mean, for me, it was really interesting to see the kind of impact you can have with infrastructure and with soap without having any kind of behavioural change intervention, which is fascinating. But just reflecting on this question, maybe just take a minute to think, just individually, and then if people can just like kind of shout out ideas, that would be fantastic. So you have 1 minute from now to have a think about it. Or if you have any questions, then please do shout them out as well. Yeah, please.
Yeah, thanks very much for the presentation, which is really good. Quite a lot of lessons been drawn from this work that you are doing. I have 1 or 2 questions, just want to seek more clarification.
Yeah, please. If you could say them into the mic for the people online, that would be great. Thank you.
So the first question that I have is on when you gave out the soap to the control group, or even maybe to the intervention group where you also provided the Jengu handwashing facility. Did you tell them the purpose of the soap? Because you did not have any behavior change kind of activity in this intervention. Just want to know, or it was up to them to decide what to use this soap for. That's the first question. The second question is on the control. Because you were looking at the presence of soap at the hand washing facility, did you, when you were recruiting the households into the control group, did you check if they had any kind of hand washing facility, or you just gave them the soap? It was up to them to have a hand washing facility because you measured presence of soap on the hand washing facility. So I'm also just interested in that. And then the last one is to do with the you captured the moments when people used soap and water when washing hands. But maybe it would also be great if you included the missed opportunities, because that would show the magnitude to say, these were the missed opportunities, these were the opportunities, but out of these are the ones that someone used soap and water for hand washing. So it would be great if that is also included in this kind of presentation. And the last one, the issue of the basins. We have seen that there are a lot of problems in the basins. Were the basins broken down? What was the cause of the basins to break down? Or what did happen with the basins? I expected to have a lot of challenges with the pumps, not the basins. So that's what I have. Thanks very much.
Yeah, thank you very much. And again, people online, remember, can also chip in. So let's start from the back. The issue of the basins. Like I said, this is a desert area. So take Dadaab to be a desert area. And then the nature of the basins were they had plastic basins. So they basically got cracked because of the sun. The facilities are put in the compound. So the cause of the breakages was to do with the sun, and this being hard, they had plastics. So if they are the soft plastics, the situation could have been different. but these are the hard plastics, so they're affected by the heat, by the sun.
Okay.
So that was the cause for the breakages. Yeah. They're really fragile, like a simple stone knocking on it actually also, yeah. And then the other aspect of the moments. So we actually captured the missed moments and also the opportunities. It's what I call the opportunities that I say we didn't present, but the results are there. So of the 100 times people wash their hands, or people go to the toilet, for example, or people are eating, so we're also capturing when they're eating but they haven't washed their hands, when they go to the toilet but they just come without washing their hands. So we have both the missed opportunities and the performed moments. So that's there, and it will be coming out either through the papers or somewhere, but that information is there to also aid the general development of practices for the service providers. Yeah, so in terms of, we didn't emphasize so much on the hand washing behavior in terms of regular messaging. But in terms of why, for example, they are getting the soap, or why the facilities were provided, of course they knew that it's to promote hygiene. You get it?
Yeah.
So the hygiene is always emphasized as part of our wash processes. So they knew that these facilities would facilitate their hygiene practices in the home. And it could be used for different forms. I mean, they're using the soap as well for washing their clothes in terms of prioritizing. Or so if you have a greater need, for example, you don't have enough soap, so instead of using soap and water, then they have prioritized, they might need it more to wash their clothes. So those instances are also there. So if you're doing active behavior change messaging, it's about re-emphasizing the importance. So to most of them, they knew soap itself is actually sufficient to keep them protected. And you see most of them only rinsing their hands with water. So those are things that we could start changing, like in their minds that, well, water, it does something, but it doesn't take away. Yeah, I think that's that. Stephen, his hand is up. Stephen, over to you.
Yeah, thank you, Innocent. And yeah, so obviously a really good question about the basins, and it is interesting and difficult to see those broken basins. I just to provide some feedback on how would we tackle that, and how would we do the basins differently. When developing the unit originally, we tested a metal basin, a stainless steel basin. And actually the basins are washing up bowls. And the reason we use washing up bowls is because they tend to be locally available everywhere. So this particular washing up bowl, I believe, is made from recycled plastic, and it's available on the local market, but they're pretty thin. And there are obviously much thicker, more resistant washing up bowls, which are also made of plastic. And on reflection, but also we did trial this stainless steel mixing bowl, and the mixing bowl probably would have been very, very robust. And we know it's very difficult to break stainless steel. So I think in response to what Innocent said, which is quite right, it's a very bright, very intense heat there, and that can break down plastic components quite quickly. So on reflection, I think we would have used a stainless steel basin, which could be more expensive. Alternatively, a different plastic basin, a thicker one, which has ultraviolet stabilizers in it. So yeah, good reflection there. And yeah, back to you.
Fantastic. Thank you very much for the interesting questions. Any questions from anyone else in the room? Please.
I had one question, and I'm sorry if I missed it. What's the cost of the system, and do you look at different materials to bring the cost down?
Yeah, thank you very much. Stephen, do you want to respond to the cost question? Yeah, we have, it's like 13, well, it depends on the category you're looking at, whether for an adult, the people's disabilities, or the children. But Stephen, you can speak to that, but it's around 13,000 for the adults. Oh, no, not
Yeah,
13,000.
sure. Yeah, I think they are around 13,000 Kenyan, you know, local currency. I can't remember the currency, I'm sorry, but so if you translate that into dollars, I guess as we're in the US, we talk dollars. It depends on where the unit is made. So if it's made in a kind of Western country here in the UK, it's probably twice as much to make as in Nairobi or Bangladesh. So the cost per unit, including the pump, the mirror, and all in, and fabrication costs, it's just over, I think it's about $110 to $130 per unit, all in all. So cost is always a challenge, and the main thing we wanted to do was to develop something that, you know, that works long term. So the basin, if we change the basin, the cost has to reflect something that works. So hope that helps to answer the question.
Yeah, basically 110. Sheila has just provided us the estimate in dollars. Yeah. Okay.
Fantastic. Any other questions? If not, then it's we're past 10 o'clock, so we'll let you go. But thank you very much, and please join me in thanking all the presenters. And please do come for Anderson's session this afternoon. We'll get into a bit more depth.
Thank you so much, everyone. Thank you so much to our online team.
Thank you, guys. Bye.
Goodbye.
Thank you. Bye.
Bye. Thank you.
Bye. Thank you.